Hi, I'm Dr. Deepak Kumar and I'm here to introduce you to the Faecal Immunochemical Test, or FIT. We'll hopefully outline the rationale for the test, the importance of the result in the patient pathway, but also introduce you to how we, as healthcare professionals in primary care, can ensure that patients understand its importance in their journey. Most of you watching this will already know that FIT is simple and easy to do, and it's a stool test. It's used to detect human hemoglobin, and it's got a very high sensitivity for detecting microscopic blood loss as well. It's also useful to add that it's used in the National Bowel Screening Programme, but the thresholds for detecting blood are slightly different. And so for the purpose of understanding, the two should be thought of differently. So let's focus on the one that we give our patients. It was first introduced about 4 years ago, and introduced for the patient cohort that met the DG30 guidance. Those patients that were thought of as low risk, but not no risk. However, in the last few years, the evidence base for its clinical use has increased, and we now understand that it's incredibly useful for assessing risk of colorectal cancer for symptomatic patients that do fulfill all of the NG12 criteria. That is the criteria for a 2-week wait referral, and they can be seen on the screen right now. Now it seems counterintuitive, but the FIT result is incredibly useful for patients that present with rectal bleeding. That is because more than half of patients with rectal bleeding will have a negative FIT. So the key message to take home is that if you are concerned about your patient having a colorectal cancer and are considering doing a 2-week wait colorectal referral for the patient, then get the FIT done prior to sending it. If you attach the FIT result with your referral, it really helps the hospital teams make the right triage decision, and therefore means that our patients will get the right diagnostic tests in a timely manner. Very simply, this is an urgent stool test that needs to be done as soon as possible. This test detects blood in the stool, and it really helps to determine what further investigations, if any, may need to be done. So emphasising the speed at which patients need to do this is quite crucial. As we all know, another key part is making sure that the test is done properly, and most of the FIT packs will have an easy to understand patient instruction leaflet for them to go through. The patient's stool pot and forms all need to have the right details on, so it's worthwhile highlighting this to patients when giving them the FIT pack. It is worthwhile letting the patients know that they can chase this result up or book in for a further consultation if we haven't done so already. From our point of view, this test is a simple investigation, but incredibly useful to our patients that present with GI symptoms. And we are working in more efficient ways in primary care. So whatever consultation type happens, be it telephone, video or face-to-face, FIT is a really good test to utilise. We should really also be able to text patients any relevant information leaflets or videos, and that's also worthwhile bearing in mind for all consultations. Because of the test, and the fact that a positive result means that patients need to be referred on the 2-week wait lower GI pathway, it's incredibly important that there are robust safety netting processes in place. All practices should have processes in place to ensure patients are safety netted, and PCNs should verify this as part of their network DES. Your practice systems may also be able to identify patients who have been issued a FIT test, but for whom no result has been received, and that will allow you to directly follow up with that patient. You will also have your own practice processes in place for when results are called through from the lab, but it's really worthwhile highlighting FIT to all healthcare staff that take those calls, so they can escalate any positive result as a matter of urgency. So hopefully this short video has provided you with a good overview as to what FIT is and the reason and rationale behind its use. It should be a test that we use for patients with GI symptoms, and the British Society of Gastroenterology has released further guidance on this. More importantly, our lower GI 2-week wait referrals should have an accompanying FIT result with them, and this ensures that our patients will get the right diagnostic treatment within the right time. Our own inbuilt safety netting processes will hopefully mean that all of the tests we give our patients are being done. As part of this primary care educational package on FIT, there have been guidance leaflets designed and an animation video for patients to explain how this testing is done. These can all be shared with patients to really empower them with information. Thanks for watching.